Hello, everybody. Hello, everybody. My name is Dr. Aamir Abbas. I'm an epidemiologist. I'm a medical doctor by background and epidemiologist by postgraduate training. I've worked on a number of research positions in leading medical institutions in Pakistan that include Khan University and Khyber Medical University. Currently, I'm studying healthcare analytics and IT from Carnegie Mellon University, which is one of the leading institution in the world. Today, I'm going to talk to you people about something extremely important. In fact, I'm going to critique some wrong analysis of COVID-19 situation in Pakistan. And this wrong analysis, unfortunately, is being done by decision makers at the highest level in Pakistan. So going further, which is the agenda for my uh, this short presentation. It is said that analysts are presenting and spreading negativity. I'm going to talk about that. It has been argued that the number of cases in Pakistan are lesser than other countries. I'm going to talk about that. The decision makers say that other conditions are being ignored because of the COVID-19 situation. Let's talk about it. Now, important point related to lockdown and the economic argument which is presented about in favor of against the lockdown in the context of Pakistan. And further, it's said that because other countries are opening, we should open as well. So we're going to talk about all these points one by one. And let's go forward. And first thing which I'm going to talk about is that it has been said that analysts are spreading negativity. Now, before answering that, I have to quote something from the World Health Organization, which has guidelines for reopening, and these are some of the guidelines related to which World Health Organization has specified for different countries to reopen in this COVID-19 pandemic. World Health Organization has specified that before reopening, the countries need to ensure that the transmission of COVID-19 is controlled, sufficient health system capacity is in place, outbreak risks in high vulnerable settings are minimized, workplace preventive measures are established, risk of imported cases are managed, and communities are fully engaged. Now, my question from the decision makers in Pakistan is that which one of these has been done in Pakistan? I think none of it has been done in Pakistan. Therefore, the analysts are not spreading negativity. They are showing the real picture. And I think we need to face the reality rather than seeing that the analysts are presenting or spreading negativity. Now, the second point, which is that the number of cases in Pakistan are lesser than other countries. Okay, so before going to answer this concern, I'm going to show you people some dashboards, and this is the dashboard from Italy. Okay, I've chosen Italy because this is one of the country which has been referred a lot in the Pakistani media, and particularly the decision makers have been referring to Italy and saying that the situation in Pakistan are not like Italy. If we see to the actual number of infections, definitely Pakistan has lesser number of infections. But check this. Italy has conducted almost more than 66,000 tests per million. Similarly, if we talk about UK, the number of infections are much larger, but they have conducted more than 70,000 tests per million. Now look at Pakistan. In Pakistan, what is happening? The total number of infections which have been reported so far are approximately 80,000, but the number of tests per million, they are only 2,700. Okay. Now, I'm going to show you people through a demonstration that this situation does not depict reality, and there's a relationship between the tests per million and the number of infections which are getting detected. The more tests you do, you are going to the nearer you are to the reality the way it is, and the lesser number of tests you do, you will end up detecting lesser number of cases, and you will be showing that there are lesser number of infections, which in fact there will be many cases which will be circulating in the society spreading infection, but you will not be able to detect that because of the lesser number of cases. So just carefully look at my subsequent demonstration, which I'm going to demonstrate on the Excel sheet. Hello, here we are seeing the prediction of the number of cases in the context of Pakistan from the first day when the cases were detected. And these are the number of days from the first day, and these are the total number of infections on the basis of SIR model. And as we are seeing, as the number of days are increasing from the first day, the number of cases are also increasing. Now, as of today, which is June 3rd, 2020, we will be anticipating, we are on the 99th day from the first day, and we'll be anticipating approximately a total of 1.3 million infections. That is assuming that there is 20% social distancing in Pakistan, which we think is a very conservative estimate, but on the basis of an assumption that the 20 that social distancing 20% of social distancing was exercised. This is the predicted number, but the government of Pakistan says that the number of cases are not that many. The official number, which is reported by the government of Pakistan, is approximately a bit more than 80,000, and it has been reported that approximately 2,700 tests per million have been performed by government of Pakistan. The total number of tests which are performed in Pakistan are approximately 5,95,000. And with these numbers, which are actually from reliable resources, we know that out of 5,95,000, approximately 80,000 individuals have tested to be positive. And the percentage on the basis of these numbers comes out to be 13.52%. In other words, approximately out of all those who test for COVID-19, approximately 13.52 individuals will turn out to be positive. Now, this is the basic setup. Now, my argument is that let's assume we increase the number of tests from 2,700 to, say, like we increase it by 2 times, right? We increase it to 5,400. Okay, so that will mean conducting this many tests, which is obviously 2 times of the total number of tests which being performed, and 13% of this number will be the total number of confirmed cases, which is this number. Okay, but 5,400, that's still a very small number. So let's increase the number of tests further. If we increase it by 3 times the number of infections, confirmed infections will increase further. And if you keep on increasing the number of tests which are performed, the number of infections go on increasing exponentially. If we increase it by 10 times, then approximately 8 lakh individuals will be detected. So rather than doing it manually, what I have done over here is I have made a data table and connected it to a graph so that it can work as a real-time dashboard. So what I'm going to demonstrate initially, that I'm going to increment the number of cases by 100, and that is I'm increasing the number of tests per million, not the cases, I'm sorry, the tests per million by 100. And I'm seeing the effect of that increment on the number of infections which are getting detected. So as you can see that if I keep on increasing by 100, the effect is not a lot. But if I increase it by, say, 500, then if I keep on increasing and increment it with 500, then this is substantial increase in the number of infections which are getting detected. If I increase it by 5,000, you can see that the number of cases which will be detected will increase substantially, as you can see right now. And so on. If I go on and keep on increasing, and I increase it by an increment of 10,000, then I can show that thing as well in the form of a live dashboard. Okay, so if I do approximately 122,000 tests per million, that this is the number of infections which I'll be detecting in Pakistan. And someone may argue that we can practically not do that many tests. Yes, that's correct, but we need to try to increase the number of infections as much as possible. There are countries in the world like United Arab Emirates, which has conducted approximately 125,000 tests per million. So on the basis of this, I think the number of total confirmed cases of COVID-19 is a direct function of the number of tests which are conducted per million. Okay, go ahead. It has also been demonstrated that it has also been said that other conditions are being ignored in this COVID-19 pandemic. And in order to answer this, I have to emphasize when they mean by other conditions, they say that the other conditions like diabetes, other conditions like hypertension or uh, hepatitis, tuberculosis, they have been ignored. Yes, I agree, but there is a basic difference between an epidemic and endemic, and that is not very well the way the argument is being made. Uh, the basic difference between an endemic and epidemic is not understood, and the decision makers need to make this distinction between an endemic and epidemic. We are in a pandemic situation, and in the context of COVID-19 virus, and we need the management protocol for the health systems becomes totally different when we are dealing with a pandemic. Now, there are some conditions which definitely need attention even in the current situation, but the question is that are rigorous infection control measures in place in Pakistan? And where are the regulatory bodies to monitor the infection control mechanisms at the level of different hospitals? Like they have a lot of, there should be regulatory bodies and they should monitor the way hospitals are managing the infection control at the level of their hospital. It should be mandatory in the routine as well, and particularly in this COVID-19 situation. And the last part is of particular emphasis that if you are going to open the routine operations in the hospitals, you are required to provide personal protective equipment to each and every person that is working in the hospital, especially those who work with any patient, whether they're doctors, they are nurses, they are paramedics, right? Because there can be anybody who will come to the hospital with a minor ailment and they will give the illness, they may be asymptomatic for COVID-19 and they may give the infection to your healthcare providers. And that's what is happening, right? Number of doctors and paramedics and nurses, they're getting infected because of this thing. So you need to provide PPEs to everybody, not only to those who are treating the COVID-19 patients. You need to provide PPE to everybody if you want to open the routine operations, even to some extent. Going forward, it has been said that the economic argument has been very much dominating and the case against the lockdown, and it has been said that we are worried about the economic losses. My question is, would such a huge spread of infection mean nothing to the economy, right? And we think that missing some days of work will be devastating for the economy. Yes, I agree with that. But how if majority of the people who are at workplace are infected and they are dysfunctional? Would that not be a problem for the economy? I mean, and at the same time, when by reopening, even you are putting the healthy portion of your company, of your workforce in vulnerable to get ill as well. And at times your economy will collapse because of the spread of the infection. And another important argument which has been presented is that there are daily wages in Pakistan who are dependent on their wages to provide for their families. Yes, I agree with that as well. But if a person doesn't earn for a month or two, yes, that is a serious problem. I agree with that. But how if that person dies because of COVID-19, the way it has been managed and the way everybody's life is put at risk by almost everybody, I think. So I think, therefore, what I think that health is wealth, and if you're not healthy, you cannot be wealthy. In the same way, if you take this principle forward, what will happen if you are not healthy, you cannot stabilize your economy as well. The next argument which is being presented is that everyone, by everyone, I mean that they are saying that all the countries in the world are opening and we should also open. Now, one thing we need to remember in the context of this COVID-19 pandemic and in any pandemic and epidemic is that the way this an epidemic works. So there's a point where you detect the first case, then the cases started to increase, then the number of the increase in the cases accelerate, and then they peak up and they reach the peak. So there's a point when the cases are increasing, then there's a plateau almost where the cases are almost, you almost get the same number of cases almost every other day, and then the cases slowly and gradually decline, right? Now, around the world, as per the guidelines of the public health professionals, countries and the lockdown is reopened in the phase when, in the point where the countries are in the when the number of cases are going downward. Nobody opens and nobody recommends opening when the number of cases are increasing. Unfortunately, in Pakistan right now, the cases have started to explode. Then they are going to substantially increase for many weeks at least, right? And it does not make any sense to open the lockdown at this point. Okay. The second thing is that World Health Organization, as I previously specified, has in their strategic document has specified some guidelines to reopen, and I think for reopening, those are also needed to be, those are also important guidelines to be considered. And what about the lockdown policy in Pakistan? My question is that, did we actually had a lockdown? We just had a joke with the lockdown. There was no lockdown. There are many questions, and the role of different stakeholders. And the federal government is saying one thing, and the provincial government is saying another thing, and there has been complete state of confusion. So all of these aspects are needed to be considered when making a decision. My take-home message in this context right now is, number one, face the reality. If you increase the number of tests, find the position the way it is. And I think government needs to increase the testing capacity on emergency basis. This is declare an emergency. Different countries have declared emergencies. I think we need to declare it an emergency, a war-like situation. Act now. It's, for God's sake, it's the matter of lives of people. It's not a joke. We have been joking. Everybody have been joking. And I think for once, we need to get serious and face the reality. Everybody, I mean, we cannot hide behind saying that, distorting the facts and saying that the cases are not there. There are a lot of cases. I do not have better choice of word to express my anger and feelings at this point, that the situation is serious and is getting extremely serious, and it's getting it will be catastrophic. So please face the reality, increase the testing capacity on emergency and war footings. And the second take-home message is that health is wealth. If you're healthy, then you can be wealthy. In other words, the economy cannot develop when the majority of the population, or a substantial proportion of the population, has an infection, and the rest of the population is susceptible to that infection. By this approach, I think even on economic grounds, you are just taking the economy to collapse as well. With this, I would request you people to please, if you agree or disagree, please send me your feedback on this email. Please share this video if you like this video. Please like this video if you like this video. Please subscribe to my YouTube channel, and do not forget to press the bell icon. Thank you very much for listening. Take care of yourself. Remember me in your prayers. Allah Hafiz and bye.